My name is Konomi. Our topic is aspiration pneumonia in the elderly people. The number of elderly people in America is increasing. The elderly people are usually more prone to disease such as aspiration pneumonia, which can be caused by oral bacteria and can be fatal. In our presentation, we will discuss the need of to provide more better oral care for elderly people and for people living in nursing homes to reduce the risk of developing aspiration pneumonia. First, what is aspiration pneumonia? It is an infection that can be caused by microorganisms after macro aspiration of matter into the lungs. Risk factors include impaired swallowing or impaired cough reflex and other incidents that can lead to accidental inhalation. Elderly people are high risk of group for developing the disease. We have two objectives for this project. One, to explore the relationship between elderly's oral health and aspiration pneumonia. Two, to explain how to reduce the risk of developing aspiration pneumonia through focusing on the importance of proper dental hygiene for elderly people. Now Nicole will go over the studies that we brought.
We investigated 3 different case studies, and we investigated these to better our understanding on aspiration pneumonia. Our first case study was a case study with 1,174 elderly patients who were diagnosed with aspiration pneumonia. These patients were then checked out by a dentist, and they investigated their oral cavity and looked in the oral cavity to see if there was any mobility, lack of swallowing. Why am I missing those? Missing teeth and present teeth. The results of this study were that people with aspiration pneumonia were more likely to have missing posterior teeth and a lower BMI. The lower BMI was due to a lack of nutrition, and due to this lack, it caused them to not be able to swallow as well, and that could lead to aspiration. And also, the missing posterior teeth led to not being able to chew as well, which led them to not fully swallowing their materials as good as when you have all your posterior teeth. And in the second case study that we did, there was 40 nursing homes, and it was split into 2. So 20 were controlled, and they were the same. And then the other 20 had a mobile dental team come and teach the elderly patients and their nursing assistants oral care techniques. And in this study, the case study that had the dental mobile team showed a higher improvement in overall oral health of their residents. And our last case study was seeing if plus oral nutritional supplement wipes would significantly reduce the chance of getting aspiration pneumonia. And in this study, it was concluded that aspiration pneumonia was a lower risk when the nutritional supplement wipes were used. Although this is the only case study that we could find on this, so it seems that more information may be needed to gather in order to draw a more conclusive decision on whether they should be used. And in conclusion, Aspiration pneumonia in elderly people is a very growing topic, and we need to make light to it so that way we can protect our elderly people for who they can't take care of themselves. Due to the lack of oral care, we as dental hygienists need to put our foot forward and make sure that we are doing everything that we can to make sure that they know the consequences of not having a clean oral cavity.
That was excellent.